Daily Show, 10:08, and I'm really excited to have this conversation today. I've been talking about this for a couple of days now, and Tom, I've been talking about precision for a few weeks now, and it's, really interesting to talk about more ways that we can truly help ourselves. And Jake, glad to have you in the studio. It's been a few years at this point since you've been on RiverBender.com.
Yes, yeah. That was a great interview I did with you. Felt very comfortable, very easy going, so I'm happy to be back.
Well, glad to have you here. And Tom, thanks for your time, and really just glad to know more about precision and really what you guys are all about. Let's start there in your background to get you familiar with our audience.
Yeah, sure. Thank you. Thanks for having us. And so precision, what we do is neuromodulation. So TMS is Transcranial Magnetic Stimulation. So basically what it does, it uses, this is kind of a nerd breakdown of it, magnetic fields through Faraday's law of inductance. Once it hits conductive tissue, like your brain, it's going to convert into a very small electric current. And then when it does that, it depolarizes those cortical neurons that we're targeting and causes that to release these neurotransmitters, your regular ones, norepinephrine, serotonin, dopamine, and then also a protein called BDNF. So BDNF is what we call in neuroscience miracle grow for the brain. So it helps form new synapses. It's brain-derived neurotrophic factor. So you do this, you get these pulses. It stimulates these cortical neurons. You do it thousands of times over the course of treatment, and it kind of reawakens a dormant part of your brain that is normally silent during depression in depressed patients.
This is really so fascinating to me. And, as somebody, and I'll be honest, I've been on the fluoxetines of the world and everything, and the feeling that I will always say I've never felt more scared in my life, because you still have the same emotions. I just didn't have the energy to really react on them and to really, just be a zombie. And, I feel like with this, and I'm sure we'll talk about this more, it seems like this is a new way to really try something that isn't going to change who we are, if that makes sense. And maybe if I'm speaking out of turn, please correct me.
Yeah, no, it's it kind of brings you back to the way you were, I feel.
Okay.
And I often use the analogy of like a computer, like, you have this circuit board, right? And if you have a broken circuit, you can't really upgrade the software. And what we can do with TMS or Spravato, which is that intranasal esketamine, you can kind of fix that broken circuit. And then once that's fixed, then you can kind of upgrade your operating system, through therapy or, other ways to help you with your depression or OCD. So
now, is this the only two mental health illnesses that we know of right now that this can help? Or
so it's FDA approved for depression, OCD, peripheral nerve pain. One of the manufacturers has one for smoking cessation.
Wow.
And and they're coming out with more. Okay. There's a ton of research for using it to help kids with autism, stroke rehab. So I think that's going to happen in the next few years. It's still considered experimental.
That would be really interesting to see play out.
Yeah, and we have a migraine. I think that one is actually FDA approved for migraine as well. So, and there is an at-home TMS device for migraine. It's called the eNeura. I know one of the reps. He's former military and great guy. His name's Eric Bolin, and so that's an at-home thing. Because, if you're having a migraine, you don't want to drive 20 minutes to a clinic, right? You can't.
It'd be dangerous.
Yeah. So this at-home TMS device can be effective for that. But we don't have anything at home yet for depression like that. I think there was a new TDCS that actually got recent approval, but I don't know the efficacy of that yet. But I'm optimistic that we're going to be able to get these ways to help people into their homes soon. Well,
and Jake, before I talk to you about your experience, I want to ask real quick, Tom, who do you get walking through your doors or picking up the phone the most? Is it the people that have kind of tried and been through it all and said, here's where I'm at, or has it been more of, I want to try this new way of medicine and have been looking into this?
Most of them are people who've had it for a long time, who've tried all kinds of different medications, and the medications just haven't worked, or they work for a little while and then they stop working. A lot of our patients are kind of at the, I hate to say this, end of their rope. I
get it.
It's a picture perfect way to describe it.
Yeah, it's
what else can I do type of thing.
Right.
Yeah.
And we had this patient a couple of years ago. She was 28. They tried all kinds of meds. They basically lost hope. They actually had taken a family vacation to kind of say goodbye because they really were scared for their daughter that, you know, she was suicidal. And then they heard about TMS and they came to us and we got her into remission. And, you know, and now
It's incredible.
she went back and, you know, did her master's and she's,
That's incredible.
That's
a true quality of life right there, you know? And that's not just getting by day by day, you know, and that's a really big, I'm sure, component of this. And Jake, you know, if it's okay, fill me in on your story with Precision and this process.
Yeah, certainly. So it was almost kind of like what you explained, just no quality of life. Like, I thought maybe I'd go through all the medications, same what you said.
Yeah.
And then I was just content, I guess. Like, okay, this is it. This is what I have to live with the rest of my life. Then I was working in the federal building in St. Louis, and he came in and did a presentation. Like, wow, this sounds interesting. Tell me more. And then, not gonna lie, I was a little skeptical at first.
I was too, honestly.
Yeah,
it was just like magnetic fields. It sounds like
That's
some
what my
late
next
night
question
TV,
was.
like
Yeah.
QVC, like this, you know, magnetic wristband's gonna, you know, cure your cancer or something. It's like, but
I saw somebody I worked with. She did the treatment. Completely different person. Like, wow, I want that. And,
Incredible.
Yeah, I started doing it. It's like, it's just, I like to, I don't know, like Wizard of Oz, you know, when she walks to the door and everything goes from black and white to color. It's like I'm living again. It's just, this whole summer, I took every weekend with my girls. We did something. 2 or 3 years ago, that would have been impossible. Just the thought of doing something every day with my kids. I love my kids, don't get me wrong, but just being able to get out of the house and do something, or just going out to lunch with a buddy, it's like, no, I don't want to do that. Absolutely not. But now it's like, yeah, let's do this.
Well, you just hit it right on the head, I think, and I'm sure you know this better than I do. All the patients and individuals that go through that same thing, where, you know, I feel like sometimes, not sometimes, the public that doesn't deal with depression or know a lot about, you know, mental health illness, they kind of categorize it as, oh, they're just sad. That has nothing to, you know,
sad or lazy.
Yeah, you know.
You know, it's like, oh, just, you know, pull yourself up.
You
and
truly feel like the weight of the world's on your shoulders. And like you said, Jake, you know, taking your kids out on the weekends and being able to do, you know, just fatherly
normal
things.
Stuff,
It feels impossible when you're, you know, 2 or 3 months in deep into a certain cycle or where you're at. And so when did you start?
So I started, I think it was roughly about 2 years ago, kind of been doing like maintenance therapy as well.
Okay.
Just within the first couple weeks of the treatment, though, it's just like I just start coming back on system. And
so it was pretty quick for you, huh?
Yeah, it was probably a couple weeks into it. Yeah. I don't know how everybody else reacts.
That's average is a couple weeks. So yeah, it's we've had some patients respond after like one session.
I can see that being dependent on.
Yeah. That's rare though. Most patients on average is about 2 weeks. Some take even longer. Some, you know, they'll notice a difference, you know, after they finish the initial 36 or so. Mm-hmm. There's a paper that came out last year that was recommending even more sessions, like 50. If people are starting to improve but not quite into remission yet, to do even more sessions.
That can sound overwhelming to somebody.
Yeah,
right. Sessions, no way. But once you start doing and doing the footwork, it's like, man, this is a reason why. Kind of like when you go to the gym, you keep doing it.
You see the results and it motivates yourself.
Yes.
Yeah.
Man, this is cool. Well, so I want to go back to what Jake said about something being a little overwhelmed, like, well, what is this type of thing?
Right.
Certainly.
You know, I feel like when folks hear baby brain stimulation or anything like that, it could be the nervousness coming in, or what does this mean? What are the side effects? What happens with it? What does that conversation look like, and what surprises them the most?
I think a lot of times when people hear about this, they think about, you know, Jack Nicholson from One Flew Over the Cuckoo's Nest, ECT, you know.
That's what I was going to ask you about. I shouldn't have, but I had that written down,
Yeah, and that's, I think, the image that comes to mind, and it's not like that at all. That is, you know, like direct electricity. What we're doing is a magnetic field, and then we're able to target specific areas of the brain. And so we're able to hit the part of the brain that's underactive in depression. So it's called the left dorsolateral prefrontal cortex. So it's right over here.
Okay.
And, you know, it's about the size of a quarter that, you know, when it hits, the electrical current spreads. And it's part of a larger circuit. So, so it's kind of like a keyhole that we access, and then it's just it's much more gentle, it's much more targeted. Side effects: mild headache.
Okay.
Yeah, and then maybe a little bit of irritation at the stimulation site from the coil. But we are very gentle. Like at the very beginning, we ramp up very, very slowly, make sure everybody's comfortable. Yeah. It should never be painful. It's like
that's what I was curious about. Is the pain threshold?
Pain
we give you a stick to bite on.
It works really well.
Right. We have somebody with a Kleenex to dry your tears. No, it's nothing like that. It's very gentle. It feels kind of like a flicking, I would say, like somebody's kind of tapping on your head. That's basically it.
That's what I was curious about. Is that similar, Jake?
Yeah, certainly. I think just minor headaches, but it's just like you just feel something sitting on your head, and then usually somebody's in the office talking with you. And
so you can still do things while you're doing this?
Yeah, you can talk. And big difference between this and like ECT is you can drive yourself to the appointments. ECT, you need to have anesthesia, you need to have a ride home and all this. And there's memory loss with ECT. There's no memory loss with this.
Wait, who are you? No.
Right. Is that why you call me John? No, that's really, and I like that you're both here. And Jake, I mean this. Thank you so much for sharing your journey as part of this. Because
kind of hard being vulnerable sometimes, but
it is, man.
If it gets the word out there, somebody can.
I actually believe in the snow globe effect, and the more we talk about this, just to let people know this option's out there, the more it destigmatizes it. Because I've talked with you already, Tom. I'm more than interested to look into this, and I'm excited to see where that can go. And we'll tour your facilities soon and get to know this. But is TMS for everyone? Because I think that's going to be important too, maybe for the public and someone that might be in a crisis right now and thinking, let's call or will this work?
It's a good question. I think you have to look at the context of that person. So if they're in crisis, if they're sitting there with a gun or they're about to jump off a bridge, no. But if they're just having suicidal ideation, like a lot of our patients, they're not actively suicidal, but like they would be okay if they didn't wake up tomorrow.
Gotcha.
They're at that kind of point. So I think it works well for people like that.
Such a relatable point too. I mean, I feel like we've all been at that point in our, it's not maybe I'm going to do this X, Y, and Z, but it is what it is type of mentality.
Right. And and stress can kind of add on to that and kind of push people over the edge sometimes. The other thing we do is Spravato, which is intranasal esketamine.
We were talking about this on the filming in on this. Yeah.
So that got FDA approval in 2019. I was still at SLU at the time, working in neurosurgery and psychiatry. And the guy who led that study, John Crystal, he's a psychiatrist at Yale. He came and gave a grand rounds to us, and I was just blown away by the data because they're saying, they can, it helps with depression, but he was also saying like it can help with suicidal ideation within a couple of hours, which that was amazing to me.
Insane.
Yeah,
that's unheard of, and
So I think in the future, I think we're going to see a lot more combination. Especially with suicidal patients, hit them with ketamine, get them off the edge, and then hit them with TMS for longer term durability because. The Spravato works quickly, but it doesn't last that long at the beginning. But the TMS takes a little longer, around 2 weeks on average. So
that way you can kind of manage until we're getting this going type of
Exactly.
Very
quick intervention, kind of stabilize the situation maybe.
Is there a certain, how do you, so if you start the, that process with it, do you have to withdraw from it as well once you start? Or how does that, just because I'm just fascinated by it.
Yeah. The original protocol does have kind of like a weaning period.
Okay.
So like you'll do 30 sessions. So it's like Monday through Friday for 6 weeks for the first 30. And then we'll taper the next 3 weeks. So we'll do 3 and then 2 and then 1 to kind of wean you off of it. Some of the other accelerated protocols, they don't really have that,
Wow.
So like there was one out of Stanford that we actually do a fair bit of that. It's is called the SAINT study. It was the Stanford Accelerated Intelligent Neuromodulation Therapy. And they were doing 10 sessions a day for 5 days.
Wow.
So you're getting a massive dose, and they were tripling the normal.
Do you stay, I guess, at that point?
Yeah.
Under supervision and everything?
Well, no, you can go home.
Oh, you can go home?
Yeah.
Wow, fascinating.
Yeah.
This is even cooler than what because I thought at that point, if you're telling me, that many sessions, I was thinking you're kind of just there.
Right. You're there all day. I mean, it's a long day, so that part is kind of exhausting.
Yeah.
But they were getting people into remission in like 2.5 days.
It's incredible.
Yeah. And there's another one that got FDA approved this past year. it's AMPA. So what they do, they give you, it's I'm not sure how they came up with this combination of medications, but it's basically Vyvanse, the ADHD medication, and D-cycloserine, which is a antibiotic for tuberculosis.
Wow. How do you get that?
I don't know.
Like a random
People way
generator.
smarter than I am. Jonathan Downer, I think, came up with that. He's I believe he's a Canadian psychiatrist, but they give that to you in the morning, you wait an hour, and then they do TMS like every half hour. So you get like 20 sessions in a day. So that's like a 1-day treatment. Wow. So that's, just now coming, to become available.
So, and that's where I think this gets exciting too, because it seems like there is a lot of development here and a lot of innovation happening where you can see some really big growth shortly. So going into this, is TMS for everyone, or are there certain things we got to take into account with what we're doing here?
Yeah, the only group I've really seen that doesn't respond to it are people with borderline personality disorder.
Really?
That's the one group I've seen where you give them all this TMS and they say it doesn't really help. What they really need is DBT, so dialectical behavioral therapy, and I think we finally found a really good therapist that can help with that. Her name's Erin. She's in St. Charles, and I can send you that information.
Yeah, please do.
Because, and she really enjoys working with them. I get frustrated because the tools I have don't help them, And
you're bringing a saw to something you need to wrench for.
Right, exactly. And she has wrenches. So, so I'm really looking forward to working with her because that's a population that you want to be able to help, but TMS by itself, I don't think is going to do it. One of the psychiatrists we work with, he thinks that giving them TMS kind of gets their brain in a state where they could be more receptive to the DBT, the DBT therapy, and therefore helpful. But by itself, I don't think TMS is going to do it. They really need DBT. Yeah. And there is research actually looking at different targets and different protocols for borderline, but that we're not FDA approved. Yeah.
Makes sense. So why don't we do this? We'll take a break. We've been talking for a little bit now, and we're going to come back and talk with Tom some more. We're talking about with Jake some more, and I really want to hear more about your experience, Jake, as we go into the second half of the conversation. Yep. You guys stay there. We're learning more about Precision TMS. You can learn more online and follow along with us. It's super simple, PrecisionTMS.org, and we'll link everything in a write-up after.
At Alton Elite Jiu-Jitsu, we help students of all ages build confidence, discipline, and real-world strength. Join a supportive community that challenges you to grow both on and off the mat. Experience the art of Brazilian Jiu-Jitsu with a 7-day free trial at our new location. Call 618-795-2692 or visit AltonElite.com to start your journey today. Train hard, serve others, live elite at Alton Elite Jiu-Jitsu. When you need a project done right, on budget, and on time, trust Gillahan Concrete. Gillahan handles every kind of project, big and small. Commercial, industrial, residential, from room additions and garages to patios, driveways, and more. Gillahan brings quality and experience to every job. Family owned with over 30 years of service to our community. Call today at 618-781-3914 or visit Gillahan.com.
Struggling with depression that just won't go away? At Precision TMS, we offer a non-invasive, drug-free treatment designed to target the areas of the brain linked to mood regulation. Using FDA-cleared transcranial magnetic stimulation, gentle magnetic pulses help reactivate underperforming brain circuits without surgery or sedation. Many patients experience real relief, even after other treatments haven't worked. Our experienced team provides personalized care every step of the way. Contact Precision TMS today to see if TMS therapy is right for you.
Throughout all life stages, you need someone in your corner, guiding you on your health and wellness journey. At OSF Healthcare, that's your primary care provider. Your OSF primary care provider is there for every stage of life. Find a provider today at osfhealthcare.org/primary.
As America prepares to celebrate 250 years of freedom, there's never been a better time to show your pride. The Flag Keeper provides everything you need to display your flag with honor, from American state and U.S. Armed Service flags to flagpoles, accessories, and installation kits for homes and businesses across the Riverbend area. Call 618-467-0020 or visit theflagkeeper.com for your free estimate today. Accidents happen in a heartbeat, but lives change forever. Whether it's a car crash, workplace injury, medical malpractice, or wrongful death, you don't have to face the consequences alone. Keith Short and Associates brings over 33 years of experience and a reputation for fighting fiercely for your rights. For relentless representation that you can trust, call Keith Short and Associates at 618-254-0055 today for a free consultation.
Tomorrow isn't built by dreamers. It's built by doers. Because progress doesn't work unless we do. So at Ameren, we've been hard at work putting energy to work for you. Adding underground cables, installing advanced switches and sensors, storm hardening poles and power lines, making the energy grid stronger today so it can meet your needs tomorrow. Learn about projects in your area at Ameren.com/energyfuture.
At Alton Elite Jiu-Jitsu, we help students of all ages build confidence, discipline, and real-world strength. Join a supportive community that challenges you to grow both on and off the mat. Experience the art of Brazilian Jiu-Jitsu with a 7-day free trial at our new location. Call 618-795-2692 or visit AltonElite.com to start your journey today. Train hard, serve others, live elite at Alton Elite Jiu-Jitsu.
Do you need to declutter your space? Time to call me, the Queen of Junk. Since 1993, we have grown to be the leader in residential, commercial, and property management junk removal. At Sparks Junk Removal, we are eco-friendly. We recycle, donate, or repurpose items back into our community. Trash is our last resort to the landfill. Plus, with our all-inclusive service, our crews handle everything from labor to lifting and landfill fees. Give us a call or visit our website, sparksjunkremoval.net, to reclaim your space today.
Welcome back, 1031. You guys couldn't hear that. See why you guys got to be in the studio with us?
Could have heard some real news today.
1032. Welcome back. We're in with Tom. We're in with Jake. And now, Tom, CEO, Clinic Director of Precision TMS. And I just want to say real quick, now that we're getting familiar, it took me 3 weeks to learn how to say See, I'm already having a problem with it. Would that help?
We can treat aphasia. Post-stroke recovery, we got you.
So going into this, Jake, I wanted to talk more about just your journey with this, and Tom, if it's okay, just because Jake, you've lived this, and what led up to if it's okay, you said you ran to this presentation. How did the process start for you? Were you a firm believer right away, or let's take me through your journey a bit?
Okay. Yeah. Well, I'll start even back a little bit before TMS. Like what kind of got me in that state where I felt like I needed this. Mm-hmm. So I went to Iraq and Afghanistan. I was a Navy corpsman, which is a frontline medic for the Marine Corps Infantry.
Wow. So
front lines, Iraq was pretty slow when I went there. Afghanistan, that was a whole different can of worms. It was really popular when I was over there. So just being the care provider for these Marines and the Taliban, Taliban gets shot, you still patch them up too. So
yeah, you got to interrogate them. No. Keep them alive.
Realistically. So the wounds of war, I guess you could say, still kind of carry over. So just having those memories of what I went through. It's been 15 years ago. Still, like, my guys passing away, and I was trying to save their lives and get shot at. But now it's, still chasing that adrenaline. I went and worked on the ambulance Jersey community at Alt Memorial. And then still treat my buddies, putting them in body bags. I'm like, man, it's time to kind of hang these boots up a little bit and maybe take care of me. I took real bad to drinking. I've been sober over 5 years now.
Congratulations,
Thank
seriously.
you. Appreciate it. And then kind of, I don't want to get too far into this, but being with the wrong people in life kind of makes things worse as well. So
it does.
And then you get to a point where it's like, okay, this is what I have to live with. This is my new norm.
This is it.
Because that's all you know.
Right.
So when this door opens about TMS, I'm like, I never heard of this. This is neat.
Yeah.
Like I said, I had a friend that did it first, and it was just night and day difference. I'm like, I want that. I didn't know that was possible. It didn't seem obtainable.
Do you think you would have done it if your friend didn't do it first?
Honestly, I think I was at the point where, what can I lose, you know?
Okay.
Yeah, I think I would have still. Because I was at that point, it's like, I've got nothing else to lose. If this makes me have a stroke and I have to live in the hospital the rest of my life, I don't care. I mean, just being honest.
Yeah.
I'm like, so I was at that point, I really didn't care whether I stayed alive. I mean, it's hard to say this right now, but my gosh, I didn't care. But now it's like, man, I want to live. And now I'm getting ready to go back to school myself and actually like push myself even more.
Hell
And
yeah,
Tom's
man.
like, yeah, living is actually normal, man. I was like, oh, this is different. He's like, no, this is normal.
You know, and that's where I want to go because, you know, number one, thank you for your service.
I appreciate
and
that.
really
Thank
do
you.
mean that. But whenever someone like yourself who is literally on the front lines tending to people that were losing their life, limb, you name it, couldn't imagine it.
Yeah.
It's, to me, hopeful for somebody else that, you know, every trauma is significant.
Oh, certainly.
And I
Yeah.
don't want
It's
to make
not
someone
war-related.
feel like, you know, it's
Yeah.
it's not. But
Yeah.
if it can help somebody like yourself who's been, I mean, through the quote-unquote ringer, dramatically speaking,
Certainly.
I think it's a good testament to anyone else that maybe is a little curious about this.
See, and this kind of gets in the way too, because some people know my background, like combat
That's
medic,
what I
and
was
then
gonna-
like, oh, but you did so much more, or you've been through so much more than me. It's like, no, my trauma's not more any different than yours. You can still benefit from this. It's not a competition who's got the worst traumas, you know?
It shouldn't be.
Yeah, but some people think it's like, oh, I'm not that bad, or I didn't experience what you did, so I don't need to do this. I'm like, no, this could still open doors and change your life.
100%. And I'm sure, Jake, there's times where there's little things that you just pick up even now still where you're like, damn, I missed out on that too.
Yes, the sunset.
Oh, yeah.
Seriously.
Yeah.
Something as simple as that. Like, I'll be driving home. I worked at Scott. And sometimes I'll be late, and it's just like, man, the sunset. I got to pay attention to my driving still, but it's like, man, this sunset.
Yeah.
It just changes things. And something I want to touch on is I lost several guys in Afghanistan. I lost more to suicide, more Marines to suicide than I did in Afghanistan and Iraq combined. So it's one of those things where it's like I really try to be, I don't try to be annoying with this, but I really do try to push this. It's like, man, I didn't know this existed. So if the more people know about this and get their lives and actually live again, it's worth it. So
I'm so glad we connected on this,
Certainly.
you know, because really, I'm all about helping ourselves. And when there's something that's proven to be working, and it to me, I'll just be honest with you, I don't like the side effects of pills. After a
Certainly.
while, I mean,
Yeah.
you know, they don't stop working, they tear your liver up, you got to eat with whatever happens with it. But, you know, why not try this way and get back to life? Yeah. And Tom, you know, going in and tying this together, how many Jakes are there that you work with? And I know there's only one Jake, of course, Jake. You're bigger than me. You're bigger than me. But in that circumstance, did you see this quite a bit?
We do. Yeah. We work a lot with veterans, and we see it quite often. And a lot of the guys, you know, they have, blast exposure, traumatic brain injury on top of the horrific things they've experienced, you know, in war, which can compound it and make it even, you know, more difficult to deal with. And but no, it's amazing to get to help these guys who've given up so much. And I spent most of my career, my academic career, studying like traumatic brain injury and PTSD in veterans, and to be able to be on the side of like the treatment side is amazing. Like I can, you know, back in research, like you're making pretty pictures of the brain, and here's damage here, and you know, looking at group differences, but to actually be able to take that and translate that and help individuals it's really fulfilling. Yeah.
Two questions on that. The first one is with TBI, so you can work with individuals that have TBI. That's very interesting.
Yeah.
That's good to know.
Yeah.
And then the other thing is, can you see it on scans on the progress, if you will, yes or no?
Group differences. Back when I was really in the TBI research, you could definitely see differences. Not on your regular MRIs. We would do kind of advanced imaging at WashU and SLU. It's called diffusion tensor imaging, where you can actually look at like the integrity of the white matter
That's
tracks.
what I was curious about. Yeah.
But yeah, you can see it there.
Wow.
And I need to kind of check in and see what the state of the art is. But I think you probably could see that damage using DTI. And there's a company, Omniscient, so they do brain mapping, and I know SLU has it, and I know WashU came out with another package similar, but basically to be able to see these white matter tracks. It was initially used for like neurosurgical planning.
That's right. Yeah. Okay.
To help avoid hitting nerve bundles that are really important, and like go in and take out tumors. But I'm kind of digressing. But yeah, you can see the damage. Definitely group differences. You can see that with TBI. And I really like doing that and showing that, especially to veterans, because being able to show them in pictures like, okay, here's a brain with TBI and here's one, a normal healthy brain. It kind of takes away that stigma, because they're thinking like, oh, I'm depressed. Well, maybe I'm being weak here.
Nope,
exactly.
I'm being a baby.
Something concrete.
Right.
You give yourself the dad talk. You know, if that makes sense.
Yeah. And to be able to see like, oh wow, I really do have an injury here. It's just like showing somebody a broken leg.
Exactly.
On an X-ray. So
And it's just, there's nothing wrong with it. Things happen, and it's just now that's just another way that we can help ourselves.
Certainly.
So going into this, I wanted to ask about just we talked earlier. Some people say it a couple of weeks. It just depended on the situation.
Yeah.
When did you, Jake, notice hey, something's happening here?
Yeah. Like I said, I went like during my lunch break when I worked at the Federal Building in St. Louis. I was on 64. And then my first couple weeks, I was like, okay, I'm just going to get this done. And then like week 2, I'm listening to music again, like actually getting goosebumps from listening to music, and traffic didn't really annoy me as much. I'm not saying everybody's going to have this same thing, but I was like, man, this is actually neat. Traffic's not bothering me. I'm listening to music, and that's when it's kind of like the aha moment.
You're just living.
Yeah. And then just going out and doing stuff with my kids, man. That's just like the greatest joy in life. Like I said, when I started seeing that kind of snowballing and crossing over the other areas of life, and it's just like now it's like, okay, I'm wanting to push myself physically now. Because with depression, I'll say it, I gained some weight with depression. Mm-hmm. So now it's like, okay, now my mental psyche's good now, so it's like I got to work on this, and then it leads to something else, and then to something else. So it's just this is like the little snowball of good that's kind of like rolling down the hill and gaining momentum in my life now. So But to go back to your question, it's just a couple weeks where it's just like, clean the house, listen to music again, and just excited,
It's incredible.
Yeah.
And let's get to the big part, because we've been talking for 40 minutes now. Tom, about insurance and how that works. Do you guys accept insurance and payment plans, or how does your office operate?
Yeah, we accept all the major insurance plans. We work with veterans, so VA, CCN, TRICARE, all the major insurance carriers. And we also do a lot of pro bono stuff. We have some patients that, they may be unemployed, they might not have insurance. And we'll take care of them.
That's incredible. I mean, I'm not to pat you on the back or anything as you're sitting here, but that's really cool that
you deserve a pat on the back.
I mean, that's how you actually believe in the damn thing. Then
it's not just that. I think it's part of like Catholic guilt too. It's like I have I have a tool that I know works really well, and I'm going to withhold that from somebody because they don't have enough money. Like, no, then their blood would be on my hands. You know what I mean? Like, if they hurt themselves, that would be on me, I feel like. So,
Can we touch on the Heroes program real quick?
Yeah, Heroes program. It's for military, active veterans and first responders, and we've expanded it to, like healthcare workers and nurses, doctors. They see a lot too, and teachers. So, we try to take care of those who take care of us.
So for anyone right now that's interested, or maybe they aren't, but they're like, man, I am stuck here. I'm kind of just, it is what it is mentality, like we talked about earlier.
Yeah.
What's the best way to get started? What's that first consultation look like? And then how long does it take to get to see you?
Yeah. I would check out our website, precisiontms.org. You can send us an email at, info@precisiontms.org, or give us a call. And then, we'll do a consult with you, kind of make sure you meet the criteria, that you'd be a good candidate. Most people are good candidates unless they have, like metal in their head or something that, that might preclude them. We actually did one case. It's kind of funny. I don't know how much time we have, but normally if you have deep brain stimulation electrodes, TMS is typically a contraindication because there's risks there. You don't want to overheat the electrodes and like fry their brain or move it out of place.
What happened?
Well, there was one other case in the world where they actually did TMS on a patient like that, and it worked well.
Oh.
Yeah, and so I showed it to my old boss at SLU, who was a neurosurgeon, and so he sent me a patient who had DBS surgery, had these electrodes, and his Parkinson's was well controlled, but he was still depressed. And he was wondering if we could do anything to help him. And so we came up with a customized TMS protocol for him to do that, and it helped him. It really helped his depression.
That's incredible.
So yeah, we published that last year. I got to go to Japan and present at a brainstem conference. But it's most people are good candidates as long as they've tried 2 or more antidepressants if without sufficient benefit, and if you don't have those contraindications, pacemaker, that can be an issue. Stimulators, but if it's MR compatible, it's typically fine. And so we just need a medical clearance letter to make sure.
You guys are seeing the website on your screen, that free consultation section. There's also a contact form that you can fill out. Give us your office locations if you could.
Yeah, so we have an office in Creve Coeur on Craig Road, and then we have one at Scott Air Force Base, a few minutes off base. It's on Pierce Boulevard off Greenmount Road, and then we're opening one at Fort Leonard Wood as well.
Wow, really good.
Yeah.
And phone number 314-673-2670.
Yeah, that's one. That's one of them. And then there's 881-TMS1.
Oh, I like that.
881-TMS1.
And we'll link that phone number. That's one we'll link in the article. And what's the best way to get started? Is it just the phone call? Do you think is that how you prefer it?
Yeah, the phone call, or if you want to shoot us an email at info@precisiontms.org, and then we'll do a consult with you. Make sure you're a good candidate. Make sure you understand, what's involved, the time commitment, and then we'll get your insurance information, get a prior authorization for you, so you don't have to worry about that. And then, we can usually get you in fairly quickly, usually within a week or two.
It's just incredible.
Yeah.
Anything else to talk about for right now, Jake? Anything else you'd like to share with the audience?
It's kind of one thing I kind of really want to hammer in on is just the commitment of 5 weeks or so, and driving every day back and forth. It just sounds intimidating for somebody that's stuck in that mindset of this sounds impossible. It's not impossible. I mean, pick up that phone, go online and look. It is a whole life waiting for you out there. I mean, it's. Like I said, it's like open that door and Wizard of Oz, everything's in color again.
Absolutely.
So, and look at Jake. I mean, he's able to treat his depression, and then, now he's getting in shape, and now he's going to school. Like, it's just kind of...
This is incredible.
The trajectory of his life has changed dramatically.
The fact, the moment you said the big thing is spending weekends and doing things and getting out of the house with your kids, man. I mean, what parent wouldn't, if they're stuck in that rut, wouldn't want that and live for it every day?
Certainly. Yeah.
And it's possible. And we'll keep meeting up, and we're going to be visiting your facilities and getting a real inside look. And I'm excited for those. We're going to bring you those right here on the Daily Show. We'll have write-ups and everything else. But now that you see the commercials, you know who Tom is, and you know exactly what services are being done for people like Jake. We'll take a quick break. We'll come back and wrap up the week that was, the first one of 2026 right after.